Okay, now that we've got a little bit of a warm up here, we're going to move into a very common problem around the world and certainly in the United States, and that is the approach to viral hepatitis. So we're going to learn about viral hepatitis. Dr. Saad, you want to start us off here?
Sure. Let's start with the beginning of the alphabet with hepatitis A. Hepatitis A virus is an RNA virus causing acute hepatitis. Hepatitis A viral infection is usually self-limited, but atypical forms include relapsing, remitting infection with cholestatic features and rarely acute liver failure. Hepatitis A virus transmission is via fecal oral route. Risk factors include international travel, contacts with hepatitis A virus infected household members, men who have sex with men, homelessness, exposure to daycare or institutionalized settings, and or recreational drug use. Hepatitis A virus incidence has declined dramatically after the introduction of universal childhood hepatitis A virus vaccination, but recent outbreaks have occurred in the United States among unvaccinated people, especially those reporting homelessness or drug use. The incubation period for hepatitis A virus is approximately 15 to 50 days. A prodrome of malaise, nausea, vomiting, fever, and right upper quadrant pain is followed approximately 1 week later by jaundice and hepatomegaly. Death is rare, but risk may be increased in those with pre-existing chronic liver disease. Laboratory studies may show aminotransferase levels exceeding 1,000 units per liter and total bilirubin levels of 10 milligrams per deciliter or higher. Acute illness is diagnosed by the presence of hepatitis A virus IgM antibodies, although false positive results may occur. Hepatitis A virus IgG antibodies indicate previous infection or vaccination and provide immunity from reinfection. Treatment is supportive, and at least 90% of patients recover fully within 3 to 6 months.